So, I read a report yesterday that insurance companies, healthcare companies, were going after the senior market, and they weren't saying why. They don't want to say this. It is like, the insurance companies don't want to let everybody know just yet, or the government doesn't want everybody to know that in 6 months they don't have to take Medicare. And it's going to be a windfall. It's going to be great for health sharing ministries. That is exactly what's happening. And now these insurance companies are being downgraded because what's going to happen is not only, so here's what's interesting. Some of the going after the seniors, you have to be aware, make sure you're not getting yourself into some sort of Medicare Advantage of some sort. You don't want to do that. If you do take Medicare, you only take original Medicare. Don't go to AARP. Don't go to anywhere else. Don't go to an insurance company and say, oh yeah, I want to, because they're always going to push you and sell you into one of those Advantage programs. Hence why we are seeing this huge uptick on senior citizens getting into debt. And when you look at it, most of them are getting into debt because of healthcare costs. They go in the hospital, they fall, they break their hip, they go in and they find out, oh, the anesthesiologist, he wasn't part of the system. The hospital was, or the surgeon wasn't, or the surgeon's, something else wasn't. Or he didn't use an approved Medicare Advantage hip replacement or something. There's all kinds of things that just because you go into a hospital that's in the network doesn't mean everybody you see is. And so they're coming out of the hospital, they're getting these bills for $30,000, $40,000, $50,000 for things that weren't under the plan. That's why if you use good old regular Medicare, that you can go to any hospital you want, you go to any doctor you want. But the upside to this really is our healthcare care ought to get better, because it's going to be really hard for the government to enforce doctors to say, oh no, you can only do Medicare patients, when they're going to have more and more people not even taking Medicare. And it's going to help those doctors open up to take more private pay or private insurance paying companies, because now those doctors are going to have the insurance lobby on their side to help them do that, because these insurance companies that are selling these private plans now, or will be selling these private plans to seniors, are going to want to make sure that doctors are out there that are taking these private plans. So in the long run, it's all good. It's a huge, huge win, finally, for seniors. So that wonderful, wonderful advocacy group called AARP, which is a joke, they, of course, had nothing to do with this. Nothing to do with it. The ones that were really working for you were groups like CCHfreedom.org, Twyla Brace, her group, fighting for this, and other groups fighting for it. Didn't have anything to do with AARP. This is the last thing they want to see happen, because they're making millions and millions of dollars. This is why I always worry. People say, well, I don't want my ministry say, I don't want to lose my 501c3. Let me tell you something. If the IRS, and I know maybe they're listening, you can come after me if you want. I'm not doing anything out of the ordinary. But if they were ever to say, well, you can't do that because you're going to lose your 501c3, my entire case would be built around the AARP, because there are a lot of things, but one thing they are not is a non-for-profit. Hey, I want to thank you for watching The Click. We sure do appreciate it. Would you go right now, click on that subscribe button if you haven't already? That helps us. We would appreciate it. Thanks again.